mini lecture on health informatics systems. I'm going to start off the discussion today by looking at a 5-component model. This is a very simple model, but the learning behind it is quite significant. The 5 components of the model are symmetrical. The endmost components, hardware and people, are actors that perform actions. The software and procedures components are sets of instructions. Software provides instructions for hardware. Procedures provide instructions for people. Data provides the bridge between the computing component on the left side of the model and the human components on the right side. The order of the components relates to the relative ease to change and the amount of organizational disruption involved in changing each of the components. The easier to manage components are to the left, and the harder ones, like people, are on the right. The process of automation involves moving work from the human side to the computer side. So I'd like to present this first of all, so that you can have this perspective when we start to look at each of those generic systems that we have. Now, very often people sort of get confused between the difference between information systems and information technology. As you can see here, and I put it in a very simplistic way. This is an equation. And information systems is an assembly or a collection of IT plus the procedures such as policies and processes that we have in healthcare organizations, plus the people which produces the information. The IT component itself refers to hardware, software, methods and standards to capture, store, process and disseminate data. So yes, we can buy and lease hardware, software licenses, databases and pre-designed procedures like modules, and we have this in hospitals. But for people, we have to make sure that they do go through training when we have the new systems on board, or existing systems for that matter. We need to overcome resistance in terms to change and in general to manage the employees that uses these systems. Now I'd like to introduce Macquarie University Hospital because they have quite an interesting story to tell. I'd like you to listen to what they have done back in 2011 when they started to implement their systems to become Australia's first and only fully digital private hospital.
iSoft IT Clinical Information Systems, including WebPass, HealthViews and MedChart, are being utilised at Macquarie University Hospital in Sydney to make it the first fully digital private hospital in Australia. Using iSoft systems, the patient's entire medical record can be added to or accessed from any computer anywhere in the hospital.
In our clinical areas, we prescribe electronically, we record progress notes electronically. When a nurse takes a patient's temperature or their weight or their blood pressure, all of that information is being put into the clinical record, which we back up across 2 separate data centre sites. For staff particularly, it means that their information is available to them anywhere in the hospital at any point in time. So whether or not a patient happens to be in the operating theatre, in the ward, in the angiography suite or the oncology unit, staff can access details on the journey that they've taken along their care pathway.
I think the advantage is the accessibility for staff. I think being able to log in from multiple points throughout the ward to access the patient files is incredibly beneficial rather than looking for a paper file on the patient.
The fact that paper records are a single unitary record of a patient's care when they go missing, when they're damaged, when they're filed incorrectly, it's very difficult to actually get that information back. In an electronic environment, you can back everything up several times. You have data integrity, you're able to better manage the confidentiality of patient information and allow people to access it in a seamless way.
We worked very hard with ISOF to establish this hospital at the forefront of medical information technology and establish something here with them that is simply an Australian first and has enormous positive repercussions for patients and doctors.
Alright, so this mini lecture is about systems, and we're going to look at a couple of very generic systems, and I'm going to use very generic names to describe them. So there are 4 groups of systems that we'll look at, and most of these are in hospitals. A patient administration system, or PAS for short, clinical information systems, or CIS. And we have a couple of many different departmental management systems from different departments, and also decision support systems. So what is a health information system? It's a system that collects data and information as part of the patient care process. But I'd like to extend that definition by looking at it's not only collecting data and information, but it's also processing the data, and it's also disseminating and sharing the data and information. So as you can imagine, data can be both administrative and clinical, and both are equally important to the patient. We will look at the concept of enterprise architecture down the track, but it's essentially a roadmap which spells out the different information systems we have in an organization, which may take on these systems as best of the breed. So they may go out there and buy the best system, let's say for the patient management system, or they could stick to one vendor and have those different systems integrate together. But the key is quite clear, hopefully. The systems have to integrate together for them to function efficiently. It's no point having different systems, perhaps best of the breed, if they do not communicate and talk with one another, because that's going to end up with silos. Now this little the chart here shows you the component of health information which are directly involved with the patient, and you can have a look at some of those components on the left hand side versus the indirect patient care, which is on the right hand side, and there are less components over there. So things like, in terms of the indirect patient care, there are business intelligence, there's data warehousing, and these are more or less behind the scene, as opposed to the one on the left hand side where these systems are quite visible. Things like patient portal, where the patient would sign in to have a look at his or her information. We have standards, which we talked about last week, and some of these components which we will look at today. So let's start off with the most important, I guess, of all systems, which is core to any hospitals, and any hospitals would have this, is a patient administration system. So as it says, it provides the administrative foundation for the whole organization. No other systems can actually function without this particular system. It houses a master database, also known as a PMI, which generates a unique identifier and basic demographics for the patient. So in a hospital situation, each of the patient has a unique identifier, which is known as a UR number. The patient administration system, or sometimes known as the patient management system, has different modules. So you can actually approach a vendor and actually purchase and install all these modules or some of these modules. But what you must have is the patient master index, because this is where the system actually allocates a unique number for each of the patient. The allocation can be both manual or it can be done by the computer. At registration, these sort of information are collected: the name, date of birth, gender, address, next of kin, so on and so forth. So the registration and the PMI goes hand in hand. However, the level of data captured at the patient registration may differ. Other modules include a module on inpatient admission. So when you're admitted, it collects the type of information like date and time of admission, which ward you're heading towards, the unit that you're going to be in, so on and so forth. There's also a waiting list module. There's bed management, and that's fairly important because they need to manage in terms of vacancy management. There's also medical record management as well, where it tracks for your medication in terms of the requests, and also when you get discharged, it will keep track of all that information. Other modules include clinical coding, which we discussed last week, and this is important because it has linked to the administrative discharge and billing system or subsystems. Another module that's within the patient administrative system can also be appointment and resource scheduling, which is the booking of clinics and so on. And referral management can also be a module within PASS. Now I just want to say a little bit about the healthcare identifier. Next week we're going to talk more about this when we start to look at the electronic health records. But I just want to point you to this part here, where it is important that we do have healthcare identifier, and it uniquely identifies the consumer or the patient for these reasons, because there are problems associated with a confusion on healthcare identifiers, which includes 25% of clinician time is consumed with information collecting, inadequate availability of patient information contributing as many as 18% of medical errors, poor information sharing and care management for chronic disease such like heart diseases suffers, and that in turn costs the healthcare system about $1.5 billion a year. So we're going to spend a little bit more time on this next week, but I just want to allude you to the fact that having a unique healthcare identifier is critical. Now let me just give you an example of a patient administrative system. This is from an organization, CSC, which offers like two different solutions. The first one, I'll start from the bottom, is a system which is very popular here in Australia. It's called I.PM, Patient Manager, and what it is a patient administrative system, and it has a lot of the modules which we just discussed. The other component of a PASS, which is offered by CSC, could be WebPass. So this is a browser-based solution, as opposed to a solution which is running out of a PC or a laptop. And this sort of solution can integrate with their mobility suite, which allows information such as patient information, images and test results being pushed to iPads and iPhones, making it really convenient for the patient. Now let's switch and look at clinical information systems. So a clinical information system is a system that manages clinical data to support patient care and clinical decision making, And this sort of data, clinical data, is been fed into CIS from various departments such as radiology or pathology. And is usually worked at the point of care. The primary goal is to make information and knowledge available to healthcare providers during care delivery. So this is not so much towards the patient, but for the providers. It is used to also streamline workflow, and we looked at that a couple of weeks ago, to eliminate inefficiency and to improve quality. The point of care clinical systems, for a reason it's called point of care, because these systems are located just adjacent to where the care takes place. And some examples of such clinical systems include the order entry, and I've got one slide on that, reporting of results, clinical documentation, medical management. These are point of care activities. If you were to have a chance to read Westbrook's paper, The Impact of Point of Care Clinical Systems on Healthcare, she says that it is really important because this has a direct impact on patient safety, the quality of care, and efficiency. Now let's look at a couple of clinical information system types. This one has to do with documentation, so the purpose here is to support documentation of care and to provide a tool to manage this delivery. It's menu driven most of the time. Another one is the computerized provider order entry system. Now this is a process of electronic entry of from the physicians. So they have instructions from the physicians for the treatment of patients under his or her care. So these orders are communicated over a computer network to the medical staff or to different departments, maybe the pharmacy, maybe the lab or radiology, responsible for fulfilling the order. The computerized physician order entry system decreases delay in order completion, reduces errors in relation to really bad handwriting or transcription. It allows order entry at the point of care, provides even error checking for duplication and incorrect doses or tests. So it is an example of a clinical information system. Some of these systems can be homegrown, and some of them can be purchased from vendors. And of course, what we discussed yesterday, in a general sense, we can use HL7, which is a standard for messaging, to transfer or to move messages between these different departments. It is another example is the e-prescription system, also known as medication management, and the whole idea here is to reduce medication errors. So the system allows the clinician to order medication at the point of care, which is quite close to the patient, rather than trying to write on prescription pads, and that has to, and sometimes with handwriting that can become an issue. So what I would like now to, if I can, is to play a video on medication management.
By your hospital bedside as the prescribing of medication goes high-tech. Doctors say the movement prevents around 70 deaths a year. Health reporter Laurie Mason with how Dunedin Hospital's showing the way.
Hello, Mrs. Smith.
It's time for Fifi Smith's afternoon pill.
I've got some ondansetron for your nausea.
With a quick click of the mouse, it's done. 2 wards at Dunedin Hospital are the first in the country to launch electronic prescribing, ditching paper charts for laptops, saving an hour per nurse per shift in lost productivity.
It saves a lot of time looking for paper charts.
and avoiding problems reading doctors' often obscure handwriting. The system's set up with alerts to ensure pills are given on time and accurately.
This warning shows me that this person has got an allergy to penicillins, which causes a rash.
Errors which claim 150 patient lives per year.
But in total, we've got at least 98% reduction in those sort of errors.
Doctors benefit too.
I can access it from my home when I'm on call, for example, and even make minor changes without having to talk to my junior staff about what I want to be done.
70 staff on wards A and B here at Dunedin Hospital have been trained on this new technology. It's only taken a few hours to get them all up and running. And although some were concerned they might struggle with the technology initially, they've all picked it up in no time.
There was a little bit of a nervousness of those that weren't perhaps quite some computer savvy, but I'm aware of one of my nurses went to 2 training sessions just so that she was able to get another opportunity to learn.
E-prescribing's now up and running in one ward at Taranaki Hospital. Waitemata DHB will launch it in November. It'll be nationwide by 2014 at a cost of $5 million per hospital.
Across New Zealand, once we've had this rolled out, I would expect we'll be able to reduce deaths by at least 75 a year, but we'll be able to reduce harm by many thousands.
Making it a very easy pill to swallow. Laurie Mason, One News.
Right, I'm back. So as you can see from the video, that allows it closes the loop in terms of the whole medication process. And I believe I have another clip here. No, I don't. Okay, but from the diagram, from the figure here, or the diagram, you can see that what we have is a couple of actors here: the physicians, the nurse, and someone from the pharmacy, and all these different systems are connected together in a closed loop. This is just an example of an article which I was reading just the other day, implementing electronic medication management at an Australian teaching hospital. This is just one of the systems, and it's a description of the implementation of electronic medical management system. And what I wanted you to look at and talk about is the success. The success of such a system in terms of its implementation depends on a couple of these interesting points. One is having a positive workplace culture in the hospital, which means there is some sense of ownership, there's leadership, there's teamwork going on. There's also the acceptance of change and work practices by the staff. There's also timely system response to user feedback, which is from the patient, training and support for the clinicians, a usable system, because if it's not usable, no one's going to use it, and it's going to be one of those systems that no one wants to use, and of course adequate decision support. Now let's look at another clinical information system, also known as the e-discharge summary system or electronic discharge summary system. This supports the electronic transfer of information from one provider to another. I would imagine some of our GPs are now using this software to receive summaries from hospitals or some other health providers, and vice versa as well. We will look at this when we start to the last point here, looks at the personally controlled electronic health records, PCEHR for short, which we will discuss in depth within 2 weeks. Now, so we have looked at patient administrative system. We have looked at some examples of clinical information systems. Now let's look at some departmental management system, and as the word suggests, these systems are very specific for the different units and departments within healthcare, especially within the hospital. However, the point is this: integration is critical, or else these systems will just be silo systems. In other words, working on their own and not communicating to anyone else, so you don't get that closed loop picture. So some systems I'll just run through fairly quickly. Pathology management information systems, which receive orders and produces results, and keep in mind this is all online. Specimen management, scheduling, billing and reporting within pathology, inventory and stock management. We also have the information system from radiology, which this system here called PACS, PACS, Picture Archiving and Communication Systems, which has its own standards, which is known as DICOM. They store X-rays, scans, and they transfer these sort of images around the place. So you could have a radiologist that's sitting at home looking at these X-rays and scans and writing those reports online. Let's have a look at this particular video here on radiology.
Every day, doctors and technicians at medical facilities throughout the country evaluate thousands of diagnostic images, X-rays, CAT scans, MRIs, and more. Often, the necessary expertise to interpret these diagnostic images is not available or located in a satellite facility. This can lead to critical delays in patient care and logistical confusion for medical staff. For an award-winning teleradiology solution or multi-site PACS network, turn to SciImage. Founded in 1993, SciImage is an enterprise imaging and information management software company that delivers a unified solution to connect multiple facilities or tie together different PACS that may be located thousands of miles apart. SciImage's unique high-com technology can acquire studies from one or many remote sites, regardless of modality or brand of PACS installed, for the purposes of remote reading or unified access.
One of the key advantages of a technology like this is when you are pulling different studies from different hospitals and putting them in one place, it provides three things. It provides archiving solution, it provides a regular PACS solution, and it also obviously provides the telemedicine solution or the teleradiology solution.
Teleradiology is no longer about preliminary interpretations from a remote location for a middle-of-the-night emergency case. Today's teleradiology solutions must solve a more critical workflow problem: the ability to fully substitute for a local physician. But it's not just radiologists that can benefit from a distributed workflow solution. Multi-facility networks also need the ability to review exams from affiliated hospitals and clinics. Modern medical imaging workflow requires that exams be available for review and final interpretation from anywhere, on any computer with standard broadband internet access. Here's how it works. SciImage's PICOM solution acquires images from each remote facility or clinic. Data is then routed using automated settings determined by the remote site and reading facility. Intelligent filtering during image acquisition ensures easy identification of the exam location and prevents the possibility of overwriting duplicate images. The PICOM solution automatically routes the exams to the correct reading physician, whether they're with the on-call overflow service or at another facility in the network. Large healthcare networks, leading university medical centers, and government institutions choose SciImage to deliver multi-facility teleradiology and image management solutions. Let SciImage show you how we can extend the boundaries of PACS technology.
Okay. There's also other departmental information systems. Pharmacy is one, another system where they have all these particular activities which is performed by the system, such as trying to manage the receipts of prescriptions, dispensing of the actual medication, printing of labels, so on and so forth. The emergency department even has its own information systems. If I'm not mistaken, one of the videos in the activities part of this within Blackboard has a clip on such a particular system from the ED. Now what's challenging here is, yes, we have a lot of data from each one of the system, but what if we consolidate all the data from the clinical systems, from the patient administrative systems, and all the departmental systems, put it together in one large data repository. Sometimes this repository is known as a data warehouse. And the data that is stored within the data warehouse is extremely useful because it is a consolidated view of the patient. It gives it a 360-degree view of the patient. So with the aim to mine, in other words, to be able to go into this data and to be able to see if there were trends or some patterns that may occur out of this huge amount of data, is really interesting. It's something that a lot of hospitals, a lot of the healthcare providers are doing nowadays, and it's all about, once you get the trends and patterns, you're able to make really good informed decisions and overall improvement of the service delivery within the institution. So this is quite an interesting topic. I think in about a couple of weeks we'll try to talk about this sort of data repository in terms of data warehousing, business intelligence. These are some of the keywords that's thrown around in industry. Now let's look at a picture here. I thought a picture would be interesting. It tells 1,000 words. It's a good story here. This is a particular product from one of the large organizations that provides this product. It's called Track Care, which is used by a number of hospitals. And what it is the whole idea behind showing this is just I want to show you the different systems or modules within the patient administrative systems. So we can have outpatient management, we have inpatient management, we have medical records, coding and grouping, and we can have medical records management. So these are some of the functionalities that were discussed just a couple of minutes ago. From the CIS area, which is the clinical information systems, we have a couple of subsystems here. The clinical area, care planning and documentation. We have some workbenches here where they can actually do their work on these virtual or logical workbenches, and results in communication, and some of the others that we have discussed. There's also the various departmental systems which we looked at: emergency department, the laboratory, it could be from radiology, or it can be the OR, maternity, pharmacy, so on and so forth. And also this particular product, Track Care, has other modules as listed here in the yellow part of this pie. Referral systems, there's analytics for you to do analysis. This is the data mining that I was talking about. Integration to mobile devices, billings is always important, order entry, prescription and medication management. The next slide is just I'll leave it on your own time to have a read at each one of these different areas. Clinical information systems, these are the things that is happening within this particular module. Then we have the PAS system, or the PAS add-ons, some of the add-ons that we can have, and of course integration to even out of the hospital, which is community care and other settings. Let's finish off by quickly looking at decision support systems, or DSS for short. These are support systems which are used for administrative and clinical decision making, and it's all about using logic to analyze data and to suggest courses of action. So these systems do not make decisions for clinicians, but they assist in making these decisions. These support systems are based on models, so therefore they tend to have a large knowledge base and data on the back end, and they have a sort of an interface to run some of the questions and query for these decision-making processes. As I said, they do not give the user the answer, but merely provide further information so that the clinician can make further decision. Now, sometimes decision support systems are also known as expert systems. I think that could be the more of the traditional name. As you can see here, the support systems or expert systems depend on rules. These rules will be defined here. For example, in this case, if you were to go through the scripts, it tends to point to the calculation of the cardiac risk factor. So these are rules in terms of what's your cholesterol, blood pressure, your sex, and according to the rules, it will then determine what your risk factor is. And then from there, the clinician can use that information to make a more informed decision. So Kawamoto back in 2005 stated that DSS are really valuable systems, but they can only be successful if they are provided as part of the clinical workflow. So it has to be part of this workflow system that we talked about. It has to be delivered at the time and location of decision making, and it also provides recommendations that you can follow up. So in summary, we have spent some time looking at, in a very, I guess, a holistic way, patient administrative systems, clinical information systems which are used by the clinicians, the departmental management systems, and there are many of them, example radiology, pathology, emergency, and as also in general, we had a quick look at decision support systems which enables clinicians to make decisions, and this is based on knowledge base. So this is the end of this module. Now for the lecture of this week, what we'll look at is possibly more examples and more descriptions and more of an interactive discussions on the various systems.